Okay, so at the end of the day, I say to my patients that it's really important, again, that they do their breathing and their stretching. I encourage them to do it up against the wall, because that will help with drainage and help with sometimes the pelvic congestion. So the feet are out to the side, and again, this is a good position, a yoga one, to prepare for sleep, so it helps with sleep as well. Often the patients will feel some kind of tingling and drainage going down through the legs, and that's good. So starting by just breathing in, and as they get a little bit longer through the hamstrings, the posterior part, they'll be able to shuffle their hips closer to the wall. So breathing in and out. And again, breathing in and out. Making sure the shoulders are relaxed and the neck is released. So just release the neck, take any tension. Remember, this is the end of the day. We're just winding down. Some people will listen to their favourite music. Other people will listen to an app like Get More Headspace to just calm the mind as they do the stretches. Some people get bored doing stretches, so it's important to have something going on in the background to keep them there. Okay, so breathing in and out. Or some patients are quite happy to be there with no external stimuli, just reflecting on the day, what went right, and what could have changed. Having done their hamstrings, now slide the legs down, and they're going to stretch through the inner thigh muscles. These adductors are often tight and short with patients with pelvic pain. Okay, so stretching out, getting the patients to use their hands for an extra little bit of stretch, and keeping the breath going, enjoying the stretch, keeping the tension out of the head and shoulders. Breathe in, let the tummy rise and fall. Again, just incorporating the breath with the stretch so that the diaphragm is releasing and the pelvic floor releasing also. What you don't want is the opposite type of breathing. They're doing their stretch, but as they breathe in, everything in the tummy gets scooped up. So they're doing a paradoxical type breath. So you want to get that release of the diaphragm. Good. Then lots of patients with pelvic pain have got inhibited glute max, and they're overactive through piriformis. So now we're going to stretch out piriformis. So sometimes you have to shuffle away from the wall. Okay, so again, shuffle away a little bit and then get yourself into position. Bring the heel onto the opposite leg and relax. Relax through the toes, relax through the pelvis, relax through the shoulders and the neck. And then breathe. Breathe in and out. Well done. Breathe in. So I do encourage you to spend at least 10 minutes doing these 3 stretches and the breathing at the end of the day. And sometimes it's good to do these at 7 o'clock, 7:30 when you get home from work, or before the children start to drive you mad. If you wait till 10, 10:30 at night, often you forget or you're too tired and you want to go to bed. So do them nice and early once you get home from work, and just check back in with the body at the end of the day. And those stretches are good because they involve drainage, breathing and stretching 3 different sets of muscles around the